Hi, I'm Preeti Mishra, a consultant with Preserva Wellness, and you are watching an interesting video where I will talk about a very common lifestyle element which exists in almost every household of our country. It is high blood pressure or hypertension. I'm sure we are all aware of what high blood pressure is. If not, here is a simple explanation. High blood pressure, also known as hypertension, is a medical condition which occur when your blood pressure increases to unhealthy levels. Blood pressure is determined both by the amount of blood your heart pumps and the amount of resistance to blood flow in your arteries. The more blood your heart pumps and the smaller your artery, the higher your blood pressure. In simple terms, the blood flow with a much higher pressure than your body required, which obviously lead to unhealthy or the other health complications. Typically, blood pressure is reading is given in millimeter of mercury with the two number, the upper number and the lower number. The upper number known as systolic and the lower number is known as diastolic. A normal BP is usually less than 120 of systolic and less than 80 of diastolic, whereas the upper number of the person with the pre-hypertension ranges 120 to 139 and 80 to 90, the lower number, that is diastolic. Meanwhile, if your systolic reaches 140 to 159 and diastolic between 90 to 99, that means you have stage 1 hypertension. And if your systolic reaches 160 or above and diastolic reaches 100 or above, you have stage 2 hypertension. High blood pressure has become the serious health concern affecting millions worldwide, and India is no exception. As per study published in the Journal of Hypertension, hypertension affect 29% of Indians. With that, 33% of urban Indians and 25% of rural Indians. With that said, only 25% of rural and 38% of urban Indians are aware of hypertension, and only 25% of rural and 42% of urban Indians are getting treated for it. Moving on to risk factor, there are many risk factor which causes hypertension like age, genetic, obesity, physical inactivity, excessive use of tobacco and cigarette, too little potassium in diet, consumption of alcohol and taking too much stress, and certain chronic conditions like kidney disease, diabetes and sleep apnea. Sometimes pregnancy also contribute to high blood pressure as well. And it is also important to note that beside adults, children can also be at risk. It is usually caused by the problem with the kidney or heart, but most of the time it is due to unhealthy diet or lack of exercise. Now let's talk about the complications regarding high blood pressure. So beside damage to the blood vessels and organs, uncontrolled high blood pressure can lead to too many complications. It can damage your arteries by making them less elastic, with the lower which lowers the flow of blood and oxygen to the heart and leads to the heart attack. This happens when the blood supply to your heart is blocked and the heart muscles begins to die without oxygen. The longer the blood flow is blocked, the greater damage to the heart will occur. And it can also cause the heart failure, which typically occurs when the heart muscle doesn't pump the enough blood it should pump. And when this happens, blood often backups and fluid can build up in the lung, causing the shortness of breath. High blood pressure can also cause arteries that supply the blood to the brain to burst and blocked, causing the stroke, which can further lead to the serious disabilities in speech, movement, and other basic activities. Stroke can also kill you. On the top of that, having high blood pressure, especially at your youth, is linked to having the poor cognitive functions and dementia in later life. It can also weaken and narrow the blood vessels in your heart, in your kidney, and making the kidney lose the ability to filter and regulate fluids and hormones and acid base balance in the body. Over the time, it can lead to the kidney failure. Thickened and narrowed or the torn blood vessels in the eyes can cause vision loss. Lastly, high blood pressure can lead to metabolic disorders such as high cholesterol level, high triglyceride and weight gain, and high insulin levels. There are many steps that one can take to control the factor that causing the hypertension, like healthy eating, regular exercise, managing stress, losing weight, reducing intake of coffee and other caffeine drinks, and so on. Taking health supplement is also another great way for this, and that brings us to this very healthy natural supplement, Cardigold juice. Aloe vera with the beetroot, lemon, hibiscus, curcumin are among the constituents in the Preserva Wellness Cardigold juice. Daily consumption of this delicious yet healthy juice helps lower blood pressure and improve blood circulation and prevent cholesterol buildup and artery blockage. Aloe vera in this juice is known to decrease the fasting glucose, triglyceride, and total cholesterol, and low density lipoprotein cholesterol, which is bad cholesterol, while increasing the high density lipoprotein cholesterol, that is good cholesterol, in the pre-diabetic and early non-diabetic people. Beetroot is high in dietary nitrate, which promote the blood flow, heart health, and exercise capacity in people with the heart disease. Lemon is powerful element for boosting metabolism and lowering weight, and hibiscus is also beneficial in lowering blood pressure in person who are at risk of or have moderate hypertension. And lastly, curcumin has antimicrobial, anti-inflammatory, and plaque reduction property, and is also beneficial in lowering the systolic blood pressure. With so much goodness in blend, this is a juice you need as far as controlling high blood pressure and promoting healthy and functioning heart. If you want to know more about this product, you can visit our website, Preserva Wellness website, which is www.preservawellness.com. Well, that's all for now. Hope you enjoyed the video, and I hope to see you all in our next exciting topic in our next video. Till then, stay safe and stay healthy.